Good afternoon. Thank you very much for joining us this afternoon. I'm Caroline James. I'm in for Donna Bush. I'd like to introduce the panel, His Excellency the Governor, the Honourable Premier, the Minister for Health, and the Chief Medical Officer. We're also joined today by our sign language interpreter, Ms. Carolyn Powell. We'll begin this afternoon with an update from Dr. Lee.
Good afternoon. I have a further 48 samples to report, which are all negative. These are spread between samples taken by the Health Service Authority and at Health City Cayman Islands. I also wanted to briefly mention the person that died in Honduras who was residing in Cayman. We have no further information on that particular issue. We've sent queries through to Public Health England and their international contacts to see if they can find information out, and through to PAHO, but we have yet to receive any response.
Thank you, Dr. Lee. We'll take some questions from the media if there are any related to that update.
Good afternoon, Dr. Lee. Rachel Ravana, Compass. In relation to the results that you've delivered today, a significant number of them being negative, how close are we to having Health City officially open its doors?
I think Health City would have to answer that question. I believe they're quite close, though. I believe they're going to be open shortly. I'm not sure if any other member of the panel has more information than me, but that would be for Health City to answer, really.
Fair enough. In relation to the negative cases, are all of the cases that we heard about from Health City now clear? Has anybody been cleared from isolation? They can now move about, well, not within curfew, but in general.
Under the current process that we have, if anybody proves positive, they remain in isolation until we take 2 samples from them, which come back negative 24 hours apart. So for some of the people, they've had their first sample. They should have had their first sample taken today of that follow-up check. But everybody else, if they've been symptom-free, would have been released from their 14-day quarantine, self-isolation period. Yes.
Thank you.
We'll move then to the Honourable Premier.
Thank you. Hello, everyone. I want to start by thanking the Commissioner of Police and the police service for the incredible job that they've been doing over the course of the past 2 nights and this morning as well with respect to the curfew. And I also want to thank the population generally for such cooperation with what we all know and understand to be a really restrictive set of rules. I think the whole country understands, quite frankly, how serious the threat is that we are trying to deal with. And I trust and hope and pray and believe that the country is going to continue, the people of the country are going to continue to cooperate through the rest of this very difficult time. The curfew, which began at 7 p.m. last night, will run through to 5 a.m. this Saturday morning. I said yesterday, and I think the day before as well, that the government was working on developing a set of rules to govern the period following the curfew, the conclusion of the current curfew at 5 a.m. on Saturday. And we have indeed completed now a set of regulations that will govern the period from 5 a.m. on Saturday through 5 a.m. on Friday of next week, when the 10-day curfew period that was initially imposed expires. These are called shelter-in-place provisions. They are not the strict shutdown that a curfew entails, but they are aimed at restricting, limiting the movement of people through the community and the opportunities for people to interact with each other. Again, part of the overall suppression plan to prevent the virus from community spread. They are going to require the continued cooperation of the community, and the police in particular will need your support and agreement if this is to work. And I say that because the shelter-in-place provisions will allow persons access to the supermarkets, reasonable access to the supermarkets, to the pharmacies, to the gas stations, to the liquor stores over the course of the next 10 days. But all other businesses that are not described as essential will remain closed. Employees are required to stay home. And essentially, if you are not going on a particular mission of great importance, to the supermarket, to the gas station, to the pharmacy, to walk your dog, to exercise for a reasonable period in a public place, you are required to stay at home. Today, I'm not going to go through the actual detail of those regulations. I've asked the Honorable Attorney General to attend tomorrow's press conference so that we can go through in detail what the regulations will entail. And hopefully the entire country will then be ready to operate under this new regime come 5 a.m. on Saturday morning. I repeat what I've said over and over again, is that if we succeed in this strategy, if we get to 14 days and there is no evidence of any significant community spread of the virus in Cayman, we will be in an incredibly good place. And then we can start to look at how we can relax some of these restrictions and slowly start to get back to a sense of normalcy within the way that we live in these islands. Today, actually, is 1 week since the first set of residents started to return from the United Kingdom. So far, so good. So I keep waking up every morning, waiting on the report from Dr. Lee, with hands clasped, pray God, no more evidence of community spread. And I think all of us in the country are probably living that way. But if we get to this point next week, I think I certainly will start to have a great deal of optimism that this strategy is actually working. But again, I appeal to everyone to please cooperate with what we're trying to do. We are still having far too many requests for exemptions from the curfew, and indeed from what will become the shelter-in-place provisions for people and for purposes which truly are not essential. Not being able to do something or to get something is inconvenient. It may make you miserable, but that doesn't mean it's absolutely essential. Never lose sight of what we're actually trying to do, which is to limit the opportunity for the virus to acquire a new host, because that's what the virus wants to do. It's always looking for another host so it can keep moving through the community. I finally want to finish with this issue of these memes. I really have had to speak to the governor and the commissioner about these memes, because it's reached a point now where I'm laughing so much I can't concentrate on my work. There was one last night of Chad Borden interviewing me, that I watched it just with the governor 8 times now. And every time I see it, I laugh even more. I fell off my chair last night. So ease up on the memes, because you're affecting my ability to concentrate on this most serious of issue.
Thank you, sir. Your Excellency.
Okay. Thank you, Premier. I first want to thank the Police Commissioner and the Police Service for what they're doing on the curfew. It is working reasonably well, and I do want to thank the wider community for cooperation, and please continue to cooperate with the police as they deal with this curfew. But as I said, so far this is working very well. Secondly, I just want to come back to the testing. It's actually, I believe, really positive that today we have 48 negative tests. So we've now done over 160, and there is only one that we have a question mark over. And I do want to remind everybody that Public Health England were here to help us establish this testing system. We also were in touch with PAHO, the Pan American Health Organization, which is the WHO of the Americas. So we can have confidence in our robust testing system. It's also the case that we have been testing all suspicious cases. So I think we need to take some comfort in that as well. But obviously, as the Premier has said as well, we do know that the curfew is hugely inconvenient, and we're asking a lot of people. But the next 10 days is absolutely crucial, and just urge everybody to do their bit and play their role and try and get us through this period and stop our people becoming ill, and we will be in a much better position. So just thank you to everyone for the continuing support and cooperation with what I believe are some very robust measures, which are exactly what is needed at this time. Thank you.
Thank you. Minister for Health.
Thank you. I'm sure there'll be another meme after I speak today. But good afternoon. Yes, Kim and Brock and Little Kim Ann even made fun of that. But I wanted to, because the whole country is on lockdown, I wanted to and I know it's different and difficult for some, I wanted to draw their attention to a song that was sung many years ago, We Are the World. I thought it was most befitting for them to listen to this on their own time. There comes a time when we heed a certain call, when the world must come together as one. There are people dying. It's time to lend a hand to life, the greatest gift of all. It goes on to say we all are a part of God's great big family. And the truth is, love is all we need. There's a choice we are making, and we're saving our own lives. So I thought that that would be something good for people to listen to. I want to say to the landlords, I ask you humbly to be socially conscionable during this time, and may God invoke love and compassion in your heart as we travel this road together. We've heard of some persons who were booted out of their apartments, and this is not really a good time for this to happen, but we did all possible to try to ensure that these persons get a roof over their heads. This is worse than Ivan, ladies and gentlemen, as there's no other country to run to. We knew when Ivan would hit, but Corona may be amongst us and we don't even know. This virus spreads like wildfire, and God is our only refuge and strength, a very present help in trouble. I say to you that if you feel the need for a fancier life of joy during this lockdown, then you are missing the point of staying alive. Let us pray and fast for the next few days. As I sought the Lord, and he heard me and delivered me from many fears, there will be a supernatural manifestation of God's divine power over COVID-19 in our region and country. I want to say to you all, when you think things are the worst here, in New Jersey, each of their hospitals only have 2 ventilators. That's how bad it is in New Jersey. And here in the Cayman Islands, and New Jersey has a population of 8.9 million people. We have a population of approximately 65,000 people, and we have over 40, and more are ordered and on the way. So I say to you, it is not all bad, and just keep praying for us as leaders. We've been having about 15 days now of press conferences, approximately. We are tired, but we are here, and the reward for us is for you to stay alive. Thank you.
Thank you. Thank you very much also to members of the public who've been sending in their questions. Many of those and many of the questions from the media concern issues related to the curfew. So I think it would be a good time to invite Commissioner Byrne to update us on matters related to the curfew and its enforcement. Thank you.
Thank you and good afternoon. So I'm very pleased to report that the policing service continues to operate on a very stable platform. Crime is all very stable and all very good, no spikes. 2 burglaries last night, that's the total of the crime commissions reported across the Cayman Islands. As it relates to the curfew implemented last night at 7 p.m, it's going very well, as has been addressed by the Governor. And just some statistics to give you an indication of the way things are going. We are out in large numbers across the islands, and I'm supported, I say thank you to Deputy Governor Manderson. I'm supported by the services of CBC and also enforcement officers from work and my colleagues in Special Constabulary. That allows us to put a large amount of cars out throughout the night and across the island. So last night in Grand Cayman, 30 vehicles were stopped. Everything went well there. 6 persons found to be in breach of curfew. 2 were arrested, 4 will be warned, or 4 have been warned for prosecution. And in Cayman Brac, 12 vehicles stopped, with the exception of 2 persons in breach of curfew, all complied as essential services. So I think we're doing pretty well across the islands in terms of the message. Just looking at the statistics from 7 a.m. this morning till just shortly before I came, our officers on patrol, they stopped 55 vehicles, and we found 10 persons in breach of curfew warned for prosecution. So the appeal is to encourage people, please comply with the terms and the conditions of the curfew, which is an indoor curfew until Saturday morning at 5 a.m. when the matter will be reviewed. So the appeal is for the cooperation for all our persons across the Cayman Islands, and to thank the people that are working with us so well. The feedback from the officers is when they are speaking to people on the street, it's been very well received, and people do understand the requirement for the curfew.
Ralph Lewis, Cayman Times. Commissioner Byrne, can you say how many police units have been assigned to the eastern districts?
Yeah, so we have the normal police units which comprise of Bodden Town, North Side and East End. And between last night and tonight, there are additional 9 units operating in the Bodden Town district, which comprises North Side, East End and Bodden Town. So an additional 9 patrol vehicles static assigned to the district. And then we also have additional roving community policing support vehicles, and we have traffic support vehicles. And the helicopter, of course, has been providing vital support to that part of the island, providing us basically eyes in the sky.
Thank you.
Afternoon, Commissioner. Just to go back to the breaches that you talked about, were there any incidents of violence? I know yesterday you told us one related to violent encounter. How did it go last night?
Okay, thankfully again last night, no violent resistance, just a requirement to make 2 arrests on Grand Cayman because there were associated predicate offences.
Okay. Also, sorry. In terms of the curfew breaches, we got reports of people congregating still last night, heading into the curfew hours, in particular on Public Beach. Are there any plans to maybe create a hotline where people can report these incidents, or should they be calling 911 to report it? Can you provide some information on that?
It has been agreed through our NEOC processes that all reports will go through 999, and that has great advantage. All reports are centrally logged and police are dispatched. So there's a response from the police and then there's an update from the police in terms of the response. So the central collating repository from 9/11 is the appropriate manner in which to deal with calls.
We meant 911, yes.
Sorry, 911, sorry. Yes, sorry.
Thank you. In terms of the additional crimes you talked about, I think it was burglaries, how much of a drain is the patrolling on controlling the other crimes? I mean, I know you're out there and you have your numbers, so is there a message that you would like to send to any would-be idle hands?
Well, we're asking people to stay indoors. That's first of all, you commit a crime, but you're also in breach of the curfew. And we'll deal with it on that basis. Normal policing operations remain in place to deal with whatever might happen. And then all of these additional patrols that I've mentioned, which are police, CBC, work enforcement, and our special constables then are out to deal with the COVID-19 enforcement, the curfew. So nothing overwhelming for the police service. And as I said, everything is very calm and everything is very stable.
Thank you.
We have had one question come in to us from Cayman News Service for Dr. Lee regarding the 48 results that came back negative. She's asking if those results have been confirmed by CARFA at this stage.
No, there's no requirement to confirm them by CARFA. All of our results are results from the laboratory and taken as being the correct ones. We've got every confidence in the results that are coming out of our lab. We will continue, as we do for any laboratory service. We use reference methods to confirm as part of the quality control processes. And so every positive result and every 10th negative result will be sent to CARFA.
Thank you.
Kevin Morales, Cayman Compass. Dr. Lee, just following up on that, given the announcement yesterday that we did have that one false negative case, is there any consideration to send more than the 1 out of 10 negative tests for the quality control, which you just mentioned?
No, there aren't. There are technical reasons why that case potentially could have been an issue, but no, there aren't, because we have confidence in the laboratory. That particular case actually came up positive on the screening test, as we were talking about that yesterday.
Do we get to a point, well, first of all, before I get to this question, logistically, how many tests are we able to do right now?
You're right, it's dropping every day. It's around 100 in round figures that we have left. As you know, the doctors' hospitals should be able to be testing quite soon. They have some reagents which are en route but haven't arrived. We have several orders out. The lead time varies between a week to 3 weeks on them, and then until they actually arrive, we can't say they're here, especially with the restrictions on travel around the world.
Right. The reason I ask is I'm wondering if we ever get to a point, a week from now, 2 weeks from now, whenever, where we sort of, I guess, widen the net on the people that we test. If we start testing people who are asymptomatic and maybe go outside of current protocol.
Yes, certainly. I mean, if we were to have the abilities, we'd be able to think about how we could be more inventive and sort of like, could we release people by doing wider testing? And absolutely, just like they have done in different countries have followed different processes, but just like they have done in Korea, and they've used testing as their means of trying to get out of their explosion, which they have very successfully done. Other countries like Hong Kong and Singapore have used different methods. So if we had that ability, yes, we would definitely consider it, and would set up a protocol to know how to use that in order to benefit all of us.
Okay. A couple more for you, if you don't mind. Specifically about the people who are working with the patients who have a positive case. We know that at Health City, 30 people were in isolation. At HSA, I believe it was 14, and those are just off of a handful of cases. should there be more that come in, is it a concern at all that we, I guess, might run out of healthcare workers who could tend to the patients at that point because they would have to be in isolation?
I mean, that's always a concern. However, we have to look at the country's resources, and the country's resources are good. So although we had an incident in one area and then an incident in another, both of those were contained, and the country as a whole has the resources because we have a lot of capacity in healthcare in Cayman. So I have every confidence. We haven't even started to tap on the private, the wider private sector and so on.
And for those healthcare workers who are still tending to the patients, what do they do to protect themselves?
The details of that I would leave to the individual hospitals to answer,
Okay.
but they follow. I mean, I know that all the hospitals are reading avidly all of the information that they've either received through shared emails or they've received through their own research, and they're following all the processes that are internationally approved. We also had people come from when Public Health England came. They came and talked about infection prevention and control. We have sessions on infection prevention and control that are being pushed out to us from PAHO, from the World Health Organization, and from Public Health England, and we are inviting all of the professionals to join in and to make sure their skills are up to date. And there are not only web-based stuff, but there's physical training about how to manage the infection prevention and control issues. So the staff are on the ready for this and are practicing good infection prevention control as we speak.
Thank you very much.
Could I just add on the materials we need for testing, because the UK government has committed to help all the overseas territories with this, and we have sourced through Crown agents some of the materials that we need for this. So the question, of course, is now how to get them here, given that the airport is closed, which is why I've been emphasising the importance of an air bridge between the UK and the overseas territories. Work on that continues, and we will be doing absolutely everything we can from a UK perspective and here to get those materials that we need here as soon as possible.
Thank you very much. Appreciate it.
This question is for Dr. Lee. Without giving any personal information, are the patients who tested positive housed or isolated in health facilities?
No, 2 of the patients are in the community. The ones that I reported yesterday, they were travellers, and they had isolated themselves when they came back, as per the request, and they continue to be isolated and followed by public health.
And to follow up, are you comfortable that they're following protocol in their communities where they're isolated?
I haven't received any reports to the contrary from public health.
Okay, thank you.
Hi, Lisa Rankin-Salins, Radio Cayman. How is the civil service handling the transition from work to home?
Well, we have the Deputy Governor here, so why don't we invite the Deputy Governor up to answer that one?
Good afternoon, everyone. I am very proud to see the seamless transition from working, carrying out your normal duties at your desk to working at home. I think it's going very well. We took a lot of time and effort to ensure long time ago that our business continuity plans were robust. We have sort of put them in place for hurricanes, so they weren't actually made for a pandemic, but we have adjusted, and I'm very pleased that it's going very well. Just today, I was informed that by our judicial administration that persons can now pay their traffic tickets online, so we're continuing to move so that we don't actually have to be at work. The response that I've gotten from civil servants has been fantastic. They have adjusted to being away from the office, and the reports that I've gotten from the public has also been very good. Everyone seems to be pleased with the transition.
Okay, thank you.
Thank you. This one is for the Premier. I know you said you're preparing the list and you'll be sending out the list, but we had a query come in if banks will be allowed to operate on Saturdays so that people can have access to their finances.
Yes, but only from 9 to 1.
Okay, thank you.
We've had, as I mentioned earlier, several questions come in related to the curfew. Many of those answers can be already found on our frequently answered questions page. That's on gov.ky/coronavirus. One that seems to be coming up an awful lot, if we could just ask the Premier or perhaps the Commissioner to clarify for the avoidance of doubt the rules concerning individual stratas versus public streets.
Individual stratas are fine. Those are not public spaces for the purposes of the regulations or the curfew order. So if you live on a strata or live in a strata, you are welcome, permitted to walk around the strata. What you're not permitted to do is to have access to the pool for other reasons, and that's been done under a separate set of regulations. But places like pools are off limits for the length of the curfew.
Thank you. Any further questions from the media? Sorry, Ralph, go ahead.
Two questions for the Premier, sir. Just to clarify with the curfew and those people on the exempted list, is it for the duration between 5 and 7? For example, those food vendors who are delivering, or can they deliver after 7?
No, food vendors are allowed to deliver up until 9 o'clock.
Okay.
But service, well, actually, no one should be going out now during this curfew period. But even when we move to the next arrangement, all of those places would be required to close at 6. But for present, they're able to deliver food up until 9 o'clock, and that'll be the case going forward as well, okay, beyond Saturday.
Okay, the next question is regarding finances, and I'll delay those questions till maybe next week when we've gotten over this curfew period. But my question is, will you be inviting a representative from the Banks Association to sit on the panel so we can ask some questions, and then maybe can clarify the plans to assist the community? Because right now we get a lot of questions as to how they're going to move forward. They have confidence in the medical society that they're doing what they should do to get us through that this phase, but what happens in the next week and a half? And there are many concerns regarding finances for small business and individuals, and we need some direct answers from the Banks Association as to how they're going to assist. And so do you have plans to invite one of those members on the panel to answer some questions next week, probably?
Well, I didn't have any such plans, but I will certainly ask them if they'd like to come along.
Okay, I'd appreciate it. Thanks.
We have no further questions. If the panel would like to add any closing thoughts?
Well, thank you. This has been an easy one. Just to say that tomorrow Cabinet will make the regulations, putting in place the new regime. And then, as I said before, we'll be able to go through it in some detail. So what we will have will be the shelter-in-place provisions, which will sort of overarch the current curfew arrangements. And come Saturday morning, the curfew will revert to the previous night's timing. So it'll be from 7 p.m. until 5, when everybody is off the streets for all purposes except truly essential matters. And then the shelter-in-place provisions will pick up at 1 minute past 5 and run through the rest of the day, all the way through to next week, Friday. But we'll explain that in a bit more detail tomorrow with the benefit and assistance of the Honourable Attorney General.
Thank you very much. We'd like to draw your attention to gov.ky/coronavirus, in particular a page there entitled Getting Assistance. That's where you can find all helplines for your medical, non-medical, mental health, human services and emergency travel concerns. Thank you very much.